video, you will learn how to use proper aseptic technique when opening and using the contents of an ampule. This is an ampule. It is a storage device within which a sterile medication or solution is stored to keep it protected from air and contaminants. Since the vial is made of glass and broken at the neck, there is a chance that small particles of glass can contaminate the sterile liquid inside the vial. Because of this, there is a chance of introducing those glass particles into the injection site after putting the liquid into a syringe. The parts of the ampule include the head, the neck, the shoulder, and the body. The neck has a ring around it where it has been filed down to have ease of opening. Before opening the ampule, gather your supplies. You will need the ampule, alcohol swabs, a filter needle, a non-filter needle, and a syringe. The use of a filter needle is required when drawing up medication or solution from a glass ampule. This allows any glass particles to be filtered out of the solution before using that solution for a patient in a final product. A filter needle looks like a standard needle and contains a filter in its base, about usually 5 microns. Filter needles are in sterile packaging until they are open. They are not to be autoclaved after use, and they should only be used once before properly discarded. Medications should be drawn up in a designated clean medication preparation area that is not adjacent to potential sources of contamination, including sinks or other water sources. Water can splash or spread as droplets move more than a meter from a sink. In addition, any items that could have come in contact with blood or bodily fluids, such as soiled equipment used in a procedure, should not be used in the medication preparation area. Examples of contaminated items that should not be placed in or near the medication preparation area include equipment such as syringes, needles, IV tubing, blood collection tubes, or needle holders, i.e. a vacutainer holder. The medication preparation area should be cleaned and disinfected on a regular basis, and any time there is evidence of soiling. In addition, there should be ready access to the necessary supplies, such as an alcohol-based hand rub, needles and syringes in their sterile packaging, and alcohol wipes in the medication preparation area to ensure that staff can adhere to aseptic technique. From an infection control perspective, the safest practice is to prepare an injection as close as possible to the time of administration to the patient. This is to prevent the compromised sterility, i.e. microbial contamination or proliferation, or compromised physical and chemical stability, like loss of potency, absorption to the container of the medication when it is transferred outside of its original container and stored for a period of time before administration. Proper hand hygiene should be performed before handling the medications, and the neck of the ampule should be disinfected with 70% isopropyl alcohol prior to breaking and allow the alcohol to dry. It is best to wear gloves when breaking open an ampule. The first step is to ensure all the liquid that may be in the head space is in the body. You can do this by either tapping the ampule gently with your finger or swirling the ampule. Then you need to wipe the ampule, especially the neck of the ampule. Place the alcohol swab on the neck area and hold the ampule securely. Place both thumbs near the neck area, one on the head, and then one on the shoulder area. Turn to the sidewall of your hood to ensure that when you open the ampule, it is not towards anybody or the HEPA filter. If you are not in a hood, make sure that you are turned away from patients or anyone else and toward a wall or surface. Quickly snap the ampule by moving your hands away from you and out from you. If it does not snap easily, rotate it slightly and try again. Do not force the ampule to break, as this may lead to unintentional injury. The ampule should break easily. If the ampule shatters or an injury occurs, do not use the medication. After successfully opening the ampule, you'll want to add your ampule contents to the compound. Safely introducing the contents of an ampule into your compound is a bit different from other preparations. Here's how to do it. First, attach the filter needle to the syringe using aseptic technique, remembering the first air concept. It is vital when compounding with the contents from an ampule to use the filter needle in order to filter out any small microscopic fragments. Then hold the ampule at about a 20-degree angle and insert the filter needle without touching it to the broken edges. Put the beveled edge of the needle into the bottom corner of your ampule. This will reduce the number of particles coming into the needle. Draw up the desired volume into your syringe. Alternatively, you can turn the needle upside down and the solution can be drawn, as there is a vacuum seal on the ampule that keeps the liquid from spilling out. Ensure that in either method that the needle does not come above the surface of the liquid, as this will create air bubbles and show an inaccurate volume. Cap and remove the filter needle from your syringe, ensuring that all of the air bubbles are out of your preparation. Change to your regular needle to be used to put the contents into your compound. It is imperative to change the needles to ensure that the previously filtered particles are not introduced into your final compound. You are now ready for the first step in your compounded preparation, IV preparation, or patient use. Here are some reminders. Protect your hands from injury by wearing gloves and using a swab or towel on the neck of the ampule before breaking it. Always use a filter needle when drawing a medication solution from an ampule. Do not use the medicine if the ampule shatters. The contents of the ampule should be immediately used and should not be stored once opened. When clearing out your workspace, ensure that the ampule pieces and needles go into a sharps container. Please contact Innovation Compounding Pharmacy for any information or if you have any questions. Thank you so much for watching. Be